Welcome to the Keto Podcast, the place where we tell the unfiltered truth about what happens after losing a huge amount of weight. We address the challenges we all face in keeping that weight off, no matter how you did it. Everything bariatric, everything weight loss drugs, and everything you need to help you keep your weight off for life. I'm your host, Mel Harris, the founder of the Keto Method, and today I'm going to be answering some more of your questions. One question that really comes up a lot is about dumping syndrome, what it feels like, what's actually happening, what causes it. You name it, anything about dumping syndrome. And I'm going to try and address that today. Your heart is racing, you're drenched in sweat, your hands are shaking, you feel nauseous, you feel dizzy, and you need to lie down right now. And yet all you did was eat 2 biscuits with your tea. Welcome to dumping syndrome. It's one of the most misunderstood complications of weight loss surgery. Some patients experience it severely, others never experience it at all, and most patients get conflicting information about what causes it and how to manage it. Now, when I first had my weight loss surgery, remember I've had a gastric bypass, which I had back in 2011, I didn't get dumping syndrome. And I was really pissed off because I was told it's a great deterrent. It makes you not eat things you shouldn't eat. And I didn't get it. And everybody was talking about how they got it, and it was really awful. And I used to try and get it. I would purposely eat things to see if it caused dumping syndrome. And it didn't. That was my experience. It didn't last. When it did come, it really hit me. And it's never left since. So today I want to break down exactly what dumping syndrome is, what the research tells us about why it happens, why some people get it and others don't, and most importantly, how to prevent it and manage it when and if it does happen. Because understanding what's happening in your body takes away the fear, and that's powerful. Now, let's start with the basics because, well, first of all, dumping syndrome is a really horrible name that doesn't actually explain what's happening. The clinical definition of dumping syndrome is it's a collection of gastrointestinal and cardiovascular symptoms that occur after eating, particularly after consuming foods high in simple sugars or refined carbohydrates. Now, just to be clear, gastrointestinal refers to anything to do with your stomach and your digestive system, and cardiovascular basically refers to anything related to your heart. So it's called dumping because food, especially sugar, literally dumps rapidly from your stomach pouch into your small intestine without properly having been digested. According to research, dumping syndrome affects approximately 20 to 50% of patients after gastric bypass surgery. And it's mainly people that have had gastric bypass surgery that suffer with dumping syndrome. But the range does vary. It depends on how it's measured and how it's defined. So for context, if you have had a gastric bypass, you have roughly a 1 in 3 chance of experiencing some degree of dumping syndrome. For other surgeries like sleeve gastrectomy, your risk is significantly lower. It's usually around about 10 to 15%. Now, here's the interesting fact. Dumping syndrome was actually first described in 1913. And that was by surgeons who were observing patients who'd had gastric surgeries for ulcers. And that was long before gastric surgery existed for bariatric and weight loss. So this isn't a new phenomenon. It's a well-documented physiological response that happens when you bypass or alter your normal digestive process. Now, there's 2 types of dumping. The research distinguishes between early dumping and late dumping. Early dumping syndrome will occur between 10 and 30 minutes after eating, and that's usually caused by rapid movement of food into the small intestine. Late dumping, which is also called reactive hypoglycemia, occurs between 1 to 3 hours after eating, and that is caused by your body overreacting to sugar and producing too much insulin. So the early onset is because your food has passed through your system too quickly. The late onset, is because you have overeaten sugar and the body produces too much insulin. And yes, you can experience both. Lucky us. Now, the highest risk factors for severe dumping syndrome are, number one, people that have had gastric bypass. Number two, larger volume meals, which trigger dumping more than, say, a small meal that you would eat frequently. Number three, very big triggers are simple sugars and refined carbs. Number four, eating too quickly of anything will increase your risk. And number five, drinking with our meals or drinking sugary beverages. Interestingly, dumping syndrome severity often decreases over time. Now, that hasn't happened for me, but many patients experience it severely in the first 6 to 12 months post-surgery, and then their symptoms become milder or less frequent as the body adapts. And this is important, some patients, like myself, experience persistent dumping syndrome for years. In fact, about 5 to 10% of gastric bypass patients have symptoms severe enough to significantly impact their quality of life. If you're experiencing dumping syndrome, I promise you, you are not alone. If you're not experiencing it, it doesn't mean you're doing something wrong. Don't try and bring it on like I did purposefully. Some bodies just don't react that way. And if you've experienced it early on but it's gotten better, that's actually the expected pattern for most people. Again, you're not doing anything wrong. Let's dive into what's actually happening in your body during early dumping syndrome. In a normal digestive system, your stomach acts like a holding tank. Your food will stay in there for between 1 and 4 hours whilst it's being broken down by stomach acid and enzymes. The stomach will then slowly release small amounts of partially digested food, which is called chyme or chyme, depending on where in the world you are, into your small intestine at a controlled rate. This controlled release is called gastric emptying, and it's regulated by a complex system of hormones and nerves. After gastric bypass surgery, this system is disrupted because your stomach pouch is tiny, literally about 30 mils initially. It may well expand to over 150 mils given time. More importantly, it bypasses something called the pyloric valve. And this is like a muscular gate that normally controls how fast food leaves your stomach. Gastric emptying after a Roux-en-Y gastric bypass can be up to 10 times faster than normal, especially for liquid and simple sugars. 10 times faster. That means food that should take 30 minutes to enter your small intestine arrives in 3 minutes. And when this partially digested, high sugar food suddenly floods your small intestine, several things happen simultaneously. First, osmotic shift. Yep, that was a new one for me as well. But sugar is osmotically active, which means it pulls fluid from your bloodstream into your intestine to dilute it. Now, bear with me here, guys, because this is a really, really long word, right? But a study in neurogastroenterology, I knew I'd get it wrong. Neurogastroenterology and motility used imaging to show that the small intestine can swell significantly during dumping episodes as the fluid rushes in. And this fluid shift causes bloating and abdominal cramping, and your intestines literally stretch. As a result, you get intense intestinal contractions, stomach aches to you and me, but really bad. Now, second of all is the hormone release. Your intestine detects this sudden glucose load and panic releases several hormones. GLP-1 we've all heard of, glucagon-like peptide 1, which slows down digestion but also causes nausea. PYY is a peptide YY. Now that signals fullness, but it also causes discomfort. Another hormone, serotonin, this increases intestinal motility, which we translate to diarrhea. Vasoactive intestinal peptide, forgive me because I know it sounds like I'm getting technical. I'm trying not to, but I want us to understand what really happens. This dilates our blood vessels. And research from the King's College in London, published in 2018, showed that GLP-1 levels in gastric bypass patients can increase by 10 to 20-fold after a sugary meal compared to pre-surgery levels. Now, that's not a small increase. That is quite literally a hormonal tsunami. Now, third, let's talk about the heart. We get cardiovascular changes because fluid is being pulled from your bloodstream into your intestine, your blood volume drops, your body compensates by increasing our heart rate, and that will maintain blood pressure. It also releases adrenaline, which causes sweating, trembling, anxiety, and it dilates our blood vessels, which can cause us to get really hot and flushed. And that is why early dumping actually feels like a panic attack combined with food poisoning because of the pain. Okay, so let's recap on that. We'll get abdominal pain and cramping, and that's been reported by 70% of dumping syndrome patients. We'll get bloating. We'll feel very, very overly full. That's been reported by 65% of patients. We feel nauseous. Again, 60% of patients. That's a lot of people that feel these things. We'll get diarrhea. We'll get something called boborygmy, and that's the medical term for intense stomach gurgling. You know, when you can hear it gurgling. Well, believe it or not, that is called boborygmy. I think that should be a name for a character in Lord of the Rings or something. So let's recap on the other things that we're going to be experiencing. We're going to be getting rapid heart rate or palpitations. Oh my goodness, 75% of people get that, and 70% start sweating appallingly. 60% of us will get dizziness and lightheadedness. 50% of us will feel very, very flush. And over half, 55%, get this intense fatigue and weakness, and we need to lie down. I know that I get all of that because I get it really severely. Now, not everyone experiences all of these symptoms. Some people might just get abdominal cramps. Others might get the full heart palpitations. But the common thread, it's intensely unpleasant and it happens fast. Most patients tell me that their symptoms they kind of start between 10 and 30 minutes after they've eaten the trigger food. Then what happens is they peak at 20 to 40 minutes and they gradually start to ease and get better, anything up to the next 60 minutes. So if you are experiencing, you're looking about an hour of feeling absolutely terrible. And honestly, unfortunately, the only thing you can do is give it time and go and lie down. There really is nothing. You can't take anything. You just got to go and lie down and let it pass. I mean, the weird thing, and it sometimes is controversial, and this is what I was told, which is why I felt like I was doing something wrong, is that some bariatric surgeons actually view dumping syndrome as a beneficial side effect. And the logic behind that, if eating sugar makes you violently ill, you'll stop eating sugar. It's that kind of negative enforcement, behavioural modification through physical consequences. Oh, if only it was that easy. Some people do find it helpful for weight loss because they will react in that way. It will discourage them from unhealthy food choices. If you're like me, I like to test the boundaries. You know, and speaking as someone who supports people through this, dumping syndrome, it's not just an oops, better not eat that. It is genuinely distressing. It can happen accidentally because you don't know if there's any hidden sugars. And also, and this is quite scary, is it can make people afraid to eat at all. So while it might technically work as a deterrent, it's not exactly a pleasant teaching method. It's not one that I particularly condone. The goal should be understanding your new body and making informed choices, not living in fear of our next meal. Now, if we talk about late dumping syndrome, which is physiologically very different from early dumping, it's still equally unpleasant. It usually comes on between 1 and 3 hours after eating, and it's caused by reactive hypoglycemia. And that's where your blood sugar crashes. This is, to put it in a sequence of events, let's just look at it like this. You eat food that contains sugar or refined carbohydrates. Between 15 and 30 minutes, because that sugar hits your small intestine rapidly and is absorbed quickly, your blood glucose spikes dramatically. In gastric bypass patients, your blood glucose can spike 50 to 100% higher than in non-surgical controls after the same sugar load. Between minutes 30 to 60, your pancreas detects this glucose spike and it responds by releasing insulin. But here's the problem. It over-responds. It releases too much insulin. Between the first and third hour, all that excess insulin drives your blood sugar down. Not just back to normal, but below normal. And that's why we head into hypoglycemic territory. The reason this happens is because after gastric bypass, the beta cells in your pancreas, the cells that make insulin, undergo something called hyperplasia. I know I am using all these long words, but I will always try and break them down so that we understand what we're talking about. When they undergo hyperplasia, they literally multiply and become more sensitive to glucose. And this is actually one reason why gastric bypass is so effective for the remission of type 2 diabetes, because your insulin producing cells become super responsive. But the downside to that is they become too responsive. When they see a glucose spike, they panic and dump insulin into your system. It's like having a thermostat that works too well. You set it to 20 degrees Celsius and it cranks the heat to 30 degrees Celsius, then it overcorrects it and it drops it to 10 degrees Celsius. So the symptoms for late dumping are kind of classic. You've got hypoglycemic symptoms, which are shakiness, trembling, intense hunger, even though you ate only 1 or 2 hours ago, sweating, especially cold sweats, irritability, anxiety, mood changes, difficulty concentrating, brain fog, weakness, fatigue, headache, blurred vision. My goodness, you could even get confusion and loss of consciousness. Now, for most of us women, if we're of a certain age, we might just say, oh my goodness, we're menopausal. Well, you men can't say that, and you younger women also can't say that. So trust me, you might be going through menopause, but these are also definitely symptoms of dumping syndrome. So don't dismiss them. Late dumping is actually particularly insidious because the symptoms are delayed. You might not connect them to what you ate 2 hours ago. You just suddenly feel terrible and you don't know why. And here's what makes it actually dangerous. Severe hypoglycemia can, like I said earlier, cause loss of consciousness. And there are many documented cases that have been published where people have been passing out whilst driving their car or operating heavy machinery, and it's all because of this reactive hypoglycemia. It's not just unpleasant, it is potentially dangerous. Yes, late dumping is less common than early dumping, but it's still significant. There are even a very small amount of people, gastric bypass patients, who actually develop severe life-impacting hypoglycemia, and that requires medical attention straight away. I said earlier that sometimes the symptoms get better over time. That's usually for early dumping. Late dumping is the one that can really persist and even get worse over time. So now we know what happens and why it happens. But another question that I get asked, well, probably more than any, is, well, why do I get dumping syndrome when my friend who had the exact same surgery doesn't? And the frustrating answer is, we don't fully understand all the variables. Nobody really knows why some people get it and some people don't. There are several factors that have been identified that influence our susceptibility. So the specific surgical technique we had matters. The size of our gastric pouch that was created, that matters. The length of the rulin, which is the bypass section of our intestine, that will matter. How the connection is made. Individual variation is how tissue heals. Two people can have the same surgery, but with anatomical differences that might be very subtle, it will affect how quickly our food travels through and whether or not we get dumping syndrome. There's also our genetics, and it's actually quite fascinating that our genetics genuinely can be a factor in dumping syndrome and our susceptibility to it. So what's the bottom line of dumping syndrome? It's really multifaceted. Okay, whether or not we get it, it could be down to our genetics, it could be down to the surgical technique, it could be down to whether or not we had a pre-existing metabolic health issue. It could be so many things, which means if you experience it, it's not your fault. If you don't experience it, you're not doing it better. You just got lucky with the combination of factors. But both outcomes are valid and both of them are real. So let's get practical. How can we prevent dumping syndrome? Well, the good news is that there are actually evidence-based strategies that we can use. The first one, and it's the most obvious one, is we have to limit our simple sugars. I would go so far as to say stop them altogether, and it's non-negotiable. The research is unambiguous. Simple sugars are the primary trigger for dumping syndrome. And when I'm talking about those sugars, I know you know what I'm talking about, but just to clarify, sweets, chocolate, biscuits, even if you've only had one, sweetened yogurt, sweetened desserts, fruit juice, smoothies, even 100% juice has got concentrated fructose. What is fructose? Fructose is another word for sugar. Dried fruits, dates, raisins, oh my goodness, very, very high concentration of sugar. Honey, syrups, jams, sugary sauces. You know the ones, your ketchup that you love, your barbecue sauce, your sweet chili sauce. They are full of sugar. Ice cream, frozen desserts. Now, I know it sounds like I'm telling you not to eat all of the things we love, but these are the primary triggers for dumping syndrome. Now, often there are other products as well that have got hidden sources of sugar. If you're eating a lot of low-fat products, they often add sugar to compensate for the taste. Beware of protein bars. Check the labels. Some of them have more than 20 grams of sugar. The flavoured coffee drinks we love, they flavour them with syrup. So do I need to say the obvious? Syrup is sugar. All these so-called healthy breakfast cereals and ready meals and soups. Check the labels. Please check the labels because they have got so much sugar. And if you reduce or cut out all those sugars, you also reduce your risk of dumping syndrome. So what do you do instead? Well, you can focus on complex carbohydrates because complex complex carbs are digested more slowly. So they cause less dramatic blood sugar spikes. And so your best choices are going to be whole grains. Now that's brown rice, whole grain bread, quinoa, oats. Especially if they're steel cut or rolled, not instant oats, please. All types of vegetables. They contain carbs, but they also have fibre. Beans, lentils, chickpeas, commonly known as legumes, really, really good for us. Sweet potato. If you eat a meal with at least 5 to 8 grams of fibre, you will have a significantly lower dumping rate than low fibre meals. And of course, always put your protein first. Always. Another non-negotiable, because protein slows gastric emptying and it moderates our blood sugar response and it keeps us fuller for longer. It's a no-brainer. Protein, but wherever possible, we need to get our protein from our food. And protein, it's in meat, it's in fish, it's in chicken, it's in eggs, it's in a certain amount of hard cheese. There's so many places we can get our protein from without going to protein shakes and protein bars. So when you eat in the correct order. Eat your protein first, eat your vegetables second, and then if you've still got room, eat your complex carbohydrates. Now, the best thing you can do to avoid dumping syndrome is eat small, frequent meals. Don't stick to 3 meals a day. You need to be eating between 5, even 6 meals a day. So that means small breakfast, snack, small lunch, snack, small dinner, maybe if you have to have a snack in the evening. As long as you're getting the right nutrients in, you'll be fine, you'll stay full, and you won't get dumping syndrome. Basically, what we know for sure is that small meals will help. A full meal, a big meal, will cause dumping syndrome. So there you go. Again, makes sense. Also, eat slowly and chew thoroughly. This is something that we always tell everybody. I know that I tell everybody I speak to, eat slowly, chew thoroughly, eat slowly, chew thoroughly. If you don't, you're putting too much pressure on your stomach and it will cause dumping syndrome again. So follow the rules. Take 20 to 30 minutes if you have to eat a meal, because that will give your body time to process the food gradually rather than just dumping it all at once. And also, we have to separate our liquids from our solids. Please don't drink with meals. Wait 30 minutes after your meal. What you'll find is that the liquid will wash the food through your pouch really quickly. So the basic rule is no liquids 30 minutes before a meal, no liquids during a meal, and no liquids until 30 minutes after your meal. Now, you also need to include healthy fats, because fat also slows down the gastric emptying and it will moderate your glucose absorption. A tablespoon of olive oil, a few nuts, half an avocado, these additions to your diet can reduce dumping risk, okay? And this is important. Fat is very calorie dense. There are 9 calories in every gram of fat versus 4 calories for every gram of carb or protein. So portion control matters. But the reality check, even if you stick to all of these strategies, even if you follow all of these, I'm not going to call them rules, I'm going to call them pieces of advice, some people will still experience dumping syndrome occasionally. Okay, there are hidden sugars, there's restaurant meals, you've got social situations, and ultimately, you're not in complete control of what the ingredients are, and these are real world challenges. Your goal should not be perfection. Your goal should be risk reduction and knowing how to manage symptoms when they occur. So, you've done everything right, but you're experiencing dumping syndrome anyway. What do you do? For early dumping, stop eating immediately. Do not try and push it through. Lie down, preferably lie down on your left side, because this position slows gastric emptying. So literally lay on your left side. Loosen any tight clothing, because anything that constricts your abdomen will make it feel worse. Focus on slow, deep breathing. This activates a parasympathetic nervous system and it can help calm the cardiovascular symptoms. So breathe and stay still, because movement will make any nausea and dizziness worse. And here's what not to do. Do not drink water to flush it through. Do not try and make yourself vomit unless it's happening naturally. Don't try and force it, because it will damage your pouch, or it could damage your pouch. Don't take anti-nausea medication during an episode, because there's no point. By the time it kicks in, the episode is usually over. And, ultimately, your symptoms are going to resolve in 30 to 60 minutes. If your symptoms do persist beyond 90 minutes, or if they get worse, then please contact your GP or your bariatric team. Don't just ignore it. For late dumping, which remember is called reactive hypoglycemia, check your blood sugar if you can. All right. If you've got one of those glucose meters, you just prick your finger and you can check your sugar level. You can get them in any chemist, or you can go to the chemist if you feel well enough and they'll check it for you. What you'll then need to do is consume 15 grams of a fast-acting carbohydrate, and that could be 4 to 5 glucose tablets. Again, you can get them in any pharmacy. You could drink 120 mils, which is a small glass of fruit juice, a tablespoon of honey or sugar dissolved in water. And then what I need you to do is wait 15 minutes and check your blood sugar again. It should be above 70 mils. If it's still low, repeat 15 grams of carbohydrate. Now, this isn't me telling you what you need to do. This is information that I have got from a GP and be a bariatric consultant. And the information is all readily available on the internet and on most websites for most weight loss clinics. When you're also going through reactive hypoglycemia, these are things what you must not do. Don't overeat. It is possible you will feel absolutely ravenously hungry, but if you eat a large meal, it will just trigger another insulin spike and you'll crash again in 1 to 2 hours. Don't eat protein or fat to treat hypoglycemia. They don't raise blood sugar fast enough. And after you've resolved it, eat a small protein-based snack like a handful of nuts or cheese stick or a hard-boiled egg. This will provide sustained energy without triggering another insulin surge. Remember to seek medical help if your dumping episodes occur more than 3 times a week, despite dietary modifications. If you experience severe hypoglycemia, confusion or loss of consciousness, get medical help. If your symptoms significantly impact your quality of life, if you're unable to maintain adequate nutrition due to fear of dumping, if you're experiencing frequent dehydration coming from frequent diarrhea, again, all of these things you need to seek professional medical help. I want to talk about fear. I've mentioned it a few times during this podcast. And it's really important. When we develop a fear, it changes our behaviours. And a lot of people have said to me that they've developed a fear of eating in social situations, a fear of hidden ingredients, a fear of trying new foods, even a fear of being far from a bathroom. And research has showed that people that have developed these kinds of fear have also developed disordered eating patterns. It means that they are restricting more than they need to because they were terrified of triggering an episode. I want you to hear what I'm saying now. Your fears are valid. But dumping syndrome is genuinely distressing. Your body is giving you very clear negative feedback. But there is a line between healthy caution a healthy fear, and a food anxiety that is going to limit your quality of life and make you develop an eating disorder. A lot of patients in our keto community have shared that they feel ashamed when they experience dumping syndrome, like it means they've cheated or failed. Embarrassment by needing to rush to the loo at the most inopportune moments. But these are just feelings. It doesn't mean it's a moral failing. It means that it's just the fact. It's a physiological response to our altered anatomy. Don't let it affect you in a way that makes you shut off from other people, that makes you swap one eating disorder with another, one addiction with another. Try to keep everything in proportion. Focus on nutritional adequacy, not avoidance. Work with us. Work with a dietitian who specializes in bariatric surgery. If you are experiencing a fear of food that means your diet is not delivering enough nutrients and minerals and hydration for what we need after surgery, you need to speak to someone who understands eating disorders, because that's possibly where you're headed. Remember, the goal is health, not punishment. Dumping syndrome is just your body communicating. It doesn't matter what other people think. It really doesn't matter. The goal is to understand the language and not fear the conversation. When I asked our community what their experience with dumping syndrome was, the responses literally showed the full spectrum. One member said, "I've never experienced it in 4 years post-op. I don't even know what it feels like, and honestly, I sometimes wonder if that makes me less protected because I don't have that negative reinforcement when I eat sugar." Lucky you. Another one said, "The first time it happened, I genuinely thought I was dying. My heart was pounding so hard, I thought I was having a heart attack. I ended up in A&E. They did an ECG and everything was normal. The doctor had no idea what dumping syndrome was. That's when I realised I needed to connect with other post-operative patients who actually understood." And then there was this one. "I had severe dumping for the first year. Now, 3 years out, I can tolerate small amounts of sugar without the symptoms. My body adapted, but I still avoid it mostly because even though I can eat it now, I know I shouldn't. The dumping syndrome in year 1 taught me habits that serve me in year 3. Well done." The takeaway? There's no universal experience. Your journey with dumping syndrome, whether you experience it severely, mildly, or not at all, is valid. And connecting with other people who understand, well, that's invaluable. If you're struggling with dumping syndrome or any other post-op challenge, come and find us at ketomethod.com, because you shouldn't have to figure this out alone. Now let's recap what we've covered here. What is dumping syndrome? A collection of symptoms caused by food, especially sugar, moving too rapidly from your pouch into your small intestine. 2 types. There's early dumping, which comes on quite quickly, late dumping, which comes on 1 to 3 hours after eating. They are both different. The first one is caused by hormone release, and the second one is caused by reactive hypoglycemia. Who gets it? About 20 to 50% of gastric bypass patients, 10 to 15% of sleeve patients. It's influenced by the surgical technique, your genetics, pre-existing diabetes status, and many other factors that we've discussed. Prevention: limit or avoid simple sugars. Focus on protein and complex carbs. Eat small, frequent meals. Eat slowly. separate liquids from solids, include healthy fats. And to manage it, for early dumping, lie down, wait it out, maybe 30 to 60 minutes. Remember to lay on your left-hand side. For late dumping, you need 15 grams of a fast-acting carbohydrate. Check your blood sugar and follow it once it's receded with a protein snack. Remember to get help if episodes are frequent. That's more than 3 times a week. If they're severe, causing loss of consciousness or impacting quality of life, get help. And here's what I really want you to take away from this episode. Dumping syndrome isn't a punishment, it's information. Your body is telling you what it can and can't handle. And that's actually a gift, even when it doesn't feel like one. Patients who maintain their weight loss long term, they're the ones who listen to their bodies, respect their new limitations, and build a sustainable relationship with food based on that understanding. You've been given a powerful tool through surgery. Dumping syndrome is part of learning how to use that tool effectively. Thank you for joining me today. I'm Mel Harris, and I hope you've now got a better understanding of dumping syndrome and that you're no longer blaming yourself if you don't get it or blame yourself if you do get it. You've been given a powerful tool through surgery, and dumping syndrome is a part of learning how to use that tool effectively. Thank you for listening today. Please let me have your feedback. I love hearing from you. Please check out all our social media. All our resources are in the show notes. I look forward to seeing you next time.